We are here with Dr. Keifer, and she's going to talk about her history of her practice. What inspired you to become a chiropractor?
Well, when I was a kid, I worked at a camp for inner city kids, and I thought these kids had so much potential. They had so many blocks in their way. I thought that's what I want to do with my life, is get the blocks out of people's way so they can really bloom. So I became a social worker, and I used to work at Franklin County Children's Services in the child abuse unit. And while I was there, I fell down the stairs, and I got sciatic pain in my back and down my leg, and I went to my family doctor, and he gave me Valium. And I had all these clients who were addicted to that drug, and so I didn't want to take that drug. So I ended up going to another doctor, and they gave me another drug, and it didn't really help. And I went to another medical doctor, and that didn't really help. And then I went to another one. So I went to 4 doctors all in about 8 months' time, and I was taking a whole lot of drugs, and I wasn't feeling any better whatsoever. And also, at the time, from the time I fell to this 8 months, my menstrual period had stopped. And all the doctors said, oh, that's not related. And I kept thinking, well, how can it not be related? So finally, a woman at work said to me, you need to see a chiropractor. And I was like, ooh, what do they do? And she goes, I don't know. You just need to go because I'm tired of watching you limp around here. So I went to the chiropractor, and he asked me about the sciatic pain. But his second question was, are you having problems with your period? And I said, well, yeah. And he said, well, the same nerve that's irritated, that's causing the pain down your leg, is the same nerve that the brain communicates with your uterus and ovaries. So once we get the pressure off of that, everything will come back to normal. And I was thinking, okay, well, this sounds good. And at the end of the consultation, he said to me, now tell me about your headaches. And I'd had migraine headaches since I had been 12 years old. They were sinus migraines. And I said to him, no, I don't talk about my headaches. They were very, very bad. I had pretty much a migraine every day. And I lived on antihistamines and decongestants and antibiotics and painkillers. And I said, no, I've been to the head of ear, nose, and throat at University Hospital. You can't help me. Nobody can help me. I have to live with these. And he looked at me and he goes, well, we'll see about that. So within about a month, my sciatic pain went away, and I never have had it back to this day. And within about 6 weeks, my period came back to normal, except no horrible cramps. And within about 2 months, I never had another migraine again. And I literally woke up one morning, and I looked at my husband, and I said, I have to be a chiropractor. And he said, do you want to be? And I said, I don't even know if I want to be, but I have to be. I set my intent in my life to help people reach their potential, and this man changed my life. So I gave up my other career and went to chiropractic school.
What is the history of your practice?
Well, when I got out of school, I started right off the bat right here in Worthington in 1987. Now, I was only 12. You have to remember that. But we started out with strictly chiropractic care. But I began to realize that patients are sicker and sicker. They are much sicker today than they were in 1987. Physical stress is higher, the sitting primarily. Mental stress and emotional stress is higher, and I think part of that's due to use of computers. And chemical stress is much higher. Our environment, the air, the chemicals in the air and the water and the food are much higher. So I realized that I needed to look at the whole picture. I had to look at the whole person and those 3 levels of stress and how we could help patients manage those stress.
How would you describe your style of chiropractic treatment?
Well, I think we are wellness-based. So rather than strictly being pain-based, like you've been in a car accident or you were hurt at work, we try to look at the whole picture and try to understand why there is pain, where that pain is coming from, but also look at the whole person. So understand what their family life is like, what their work life is like. You know, are you exercising? Are you getting enough sleep? What's your nutrition like? So we look at the whole picture.
What are health issues that chiropractic care can help with that people might not be aware of?
Well, we started talking about that when you first came to the office. So most people think about us for headaches or back pain or neck pain or carpal tunnel, and we are very good at that. The research says we are the most effective at that. But what people don't realize is when the nerve is irritated, it can block the communication with the brain, and that could be to the lungs, like we talked about the little girl with asthma. I've had patients with colitis or stomach problems. get much improved with chiropractic care. And a lot of the time, it's just things like fatigue and low energy and sleep. Because when we're out of alignment and things aren't working the way they're supposed to, oftentimes people are very tired and they may just be achy. There's just different ways of getting people healthier.
How young can a young child be to receive chiropractic treatments?
Well, I've adjusted babies 3 hours old. So what happens is when the babies are being born, the doctors grab the neck of the baby, the base of the skull, and they pull and they twist. So sometimes the baby's upper neck gets out of alignment. And that can cause things like stomach or digestive problems, colic, ear infections. So different kind of problems can resolve. I had a patient come in one time. She brought her 18-month-old baby in, and he had never slept for more than 20 minutes at a time. And when he wasn't sleeping, he was screaming. And they had done all kind of tests, CAT scans, MRIs, everything. She was just desperate. And when I checked him, of course, adjusting a baby's just about like this much. And I could feel that his upper neck was out of alignment. And we just put a little bit of pressure. And the mom called me that night and said, "What should I do?" And I said, "Why? What's going on?" And she goes, "Well, he fell asleep in the car, and he's still asleep now." And I said, "I think he needs food. I think he needs sleep more than he needs food. Just let him sleep."
Do you treat athletes?
Yes. Athletes really need to be under chiropractic care, because when you're going to abuse your body like a lot of athletes do, all the joints in our body, whether it's our knee, our shoulder, or our spine, when it's in alignment, it glides. But when it gets out of alignment, it grinds. And that's really what causes the wear and tear on the joints and arthritis. So, for a while we had the whole women's gymnastic team at Ohio State as patients. And about 25% of those girls had had chiropractic care since they'd been about 4 or 5 years old. And the other group had never had chiropractic care. The group that didn't have chiropractic care, even at age 20, 21, already had arthritis in their spine.
How much a part of your practice is educating your patients?
A whole bunch of it. That's really, I think that's at least half the practice. Every single day when a patient comes in, we do an educational moment. It might be one day it's on sleep, one day it's on exercise, one day it's on nutrition. And from the time a patient comes in the door, I try to learn as much about them as I can. And then I really teach them about their own body, because it's their body that does the healing. I don't do the healing. I just kind of get the blocks out of the way so that their body can heal itself. But they need to understand how to nurture that body, how to feed it well, how to exercise it, how to get enough sleep, how to get off those darn computers, those kind of things. And so for all new patients, we do about an hour-long workshop on Monday nights at 6 o'clock. And we kind of go through a lot about, we call it the stress recovery orientation. So what you can do in your own life to empower yourself to be healthier. And then every single time a patient comes in, we always do education.
What do you find the most rewarding about being a chiropractor?
Well, you get to see a miracle every day. I mean, sometimes just a little miracle, somebody's migraines are doing much, much better. Sometimes it's a big miracle, like the little baby I saw or the little girl with asthma. But it's, we're always helping people, and we're helping them, their body to do really what it needs to be, and we're not harming them in any way.
If someone would like a consultation, how does that work?
Well, basically they call our office and they make an appointment. The first time they come in, I like to spend about an hour with them. So we sit down and we talk about, just like we talked about, their physical stress, their emotional stress, their chemical stress. We try to figure out this is the right place to help them. If it is, great, we'll set up a plan for them. If it's not the right place, though, I'll try to help them find where they need to go.
If people would like to learn more about your practice, how can they do that?
Well, probably go to our website, Worthington Optimal Wellness. They can call our office, 614-848-5211. And they can always set up a consultation with one of the doctors to just sit and talk with us.
Thank you for your time.
Thank you.
This has been Nadia Payden reporting for the Digital Media Club.